basically the awareness, not just amongst the general public, but also amongst healthcare professionals, of the relevance of cognitive issues is diabolical. We are in a pandemic right now, but I'm still fighting for cognitive assessments to be conducted on patients coming in with COVID-19. Now, do you know that 1 in 3 people with COVID-19 have cognitive impairment? That people can go through their entire hospital journey, get discharged, and not followed up because there's still a lack of recognition that COVID-19 is not just an acute disorder. It actually lasts far, far longer than the acute illness itself. And they are actually sent back to work without actually anyone testing their cognition. We need a huge level of increase of an awareness. People need to be aware that cognitive impairment itself is actually the single biggest determinant of your chance of recovery when they come to hospital. So all patients who ever encounter healthcare services above the age of 60, in fact, I'd say all patients, all adult patients, should have a memory screening. And we've already developed a very simple tool, and we hope that our healthcare service will embrace that urgently.
In practice, what we do is that, as I mentioned, medication review is very important. List down all the medication, and you need to understand what are the diseases that this patient has, and then evaluate which are the medication actually taking as what being given. Sometimes you give 10, but they're only taking 5, but they are working healthier, like nothing wrong with them. So, and there are also the other way around, whereby you're giving 10, they are taking all 10, but they had multiple falls, they had all sorts of adverse events, they looked weak, they didn't look better as before. So then we identify each of the problems, we bring it to our team. As I mentioned, never one-man show. You need team. Of course, geriatrician, by having geriatrician is the best service that you should have. I understand that we don't have enough right first time.
We have even fewer geriatric pharmacists.
Okay, and when we have that team, then only at the end we can conclude which one to maintain or deprescribe or to optimize. As I mentioned, you need to really evaluate the medication profile.